Thank you for all of those who have joined already and are still coming in. I am going to get started in just a minute or two, give people a few more minutes to pop in. For those still joining, I will get started in about a minute or two. Just give a few more people to get in and get settled and get ready. So we are just at a minute past, almost 2 minutes past, but I will go ahead and get started. Thank you all for joining us today for this walkthrough of the COVID-19 Data Project's policy track in our policy dataset. My name is Allison Muir. I am the operations manager for BroadStreet, and I also helped establish and currently help run the policy track. For this webinar, the majority of it will be left for Q&A, but I do want to give you all an overview of what the internship is, and the internship as being the COVID-19 data project. And then I also would like to give you an overview of how our data set is generated and what is included in it. After that, I will give you a walkthrough of our actual data set and how it can be read. And then any time for question and answer about details in the data set or how it's created, how the internship is run, anything related to that. The COVID-19 data project is a part of BroadStreet Health. It was created in March in direct response to the pandemic, when the co-founders of BroadStreet realized that there was worlds and worlds of data and we needed a way to get it out and get it so that everyone could understand it. It started with just the co-founders gathering the daily cases and daily deaths, and quickly they realized that they would not be able to gather all the information alone. Today, we now have over 450 active volunteers. Over the course of the past few months, we have seen over 800 volunteers come and help us create both the policy data set and our other data sets within the project. We have been humbled by the outpouring from the collegiate community and those who are willing to dedicate their time to help us grow our data sets and just get course credit and anything and everything for these students. While the policy data set is the main data set I will be talking about today, we have other tracks, as we call them, that our interns can be a part of. When an intern joins the project, they're sorted into either the daily numbers track, the health equity track, or the policy track. The policy track is what we are talking about today, which generates machine-readable documents and qualitative data on orders. But the other tracks also deal with data and generate their own data sets that are published. The health equity data set looks at county level counts, COVID counts by race and ethnicity. And what we call our COVID-19 daily numbers track is both a data entry and quality assurance track that looks at county level daily case and death counts, including probable cases and probable deaths. The interns are sorted into these tracks based on their interests, the needs of the teams, and where they would be a best fit for their schedule. Now, the policy data set is unique in that it is not just simply numbers. So rather than an individual going onto a website and entering numbers as they see them, we operate under what we call data bursts or team meetings. We use Zoom for just about everything, and the teams meet over Zoom and work together. What you see here is an example of what our spreadsheet looks like. So during the team meeting or the data burst, the teams will meet and go through each order and each document to gather the information that eventually is published on the data set you will see in just a few minutes. The formatting is very user-friendly for our teams, but we do take that off and pare that down for when it is published so that there is not an overwhelming sense of color in the rainbow coming at your senses. In terms of what is in the policy data set, we do have two things. We have machine readable versions of any and all of the orders that we read and the qualitative data set with the numbers. When I say orders, when I say policies, what that includes is emergency declarations, public health orders, statutes, regulatory documents, and mitigation policies. Anything that is not a press release that has a sense of order, that has a sense that it could be enforced, is included in our data set. We make these into machine readable versions of text files because we have found that every state, every city, every county, everyone publishes them differently, and they often use fancy formats, fancy PDFs, and it's just not machine readable. It's readable to the human eye, but that's about it. So we take the time to convert them and to change them into machine readable formats so that they can be reviewed. If you were to go onto the published link for our machine readable versions or download the zip file, this is what you would see. We have folders separated first by what type of region it is. So the cities or counties, the states and the territories, and then the federal documents. From there, we have subfolders that break down where the order actually is for. I have the example here of territories simply because we have hundreds of cities included and 50 states, and it's just too many for a single slide. But we do include all of these territories, and each has their own folder separated. If you were to go into one of these folders, you would then find the individual documents for each order that has been published. Each order that is in these folders is also represented in our data set. The numbers and the names align as closely as possible, but it is included if the name is not an exact match. In terms of what is on the actual spreadsheet that I will show you, we read by hand and we use the find feature often when reviewing the orders, and we recognize multiple aspects of each order. We have identifiers, which helps us link to the document that is the text file, being the name or number of the order, whether it's a public health order, a stay-at-home order, anything like that. Most of them have numbers. We also recognize and designate and say in the spreadsheet what the geographic location is. We call it a geotype for ease of space in our spreadsheet, but the geographic location, by stating that, tells us immediately where it is and also the size of that area. It also allows us to put everything into a single tab or a single sheet so that it can be grouped alphabetically. The amendment status and the reopening status as identifiers tell us how the orders relate to other orders. We have found that reopening orders are much longer than others, and amendment orders are also often either repetitive or very short because they are applying to a previous order. So we do call those out and recognize them. We also enter what the effective period of the order is. Even if it has been rescinded or amended, we have the original effective period of that specific order. We also only want to include COVID applicable orders in our data set. So we recognize if something is in response to COVID by looking simply for the term COVID-19 or the coronavirus pandemic. If something is found not to be related to COVID, it could be related to a natural disaster or anything that happened within the past year. We do eliminate those from our data set because they are not technically applicable. In addition, we recognize if something is the original or initial declaration. There are states such as Michigan that rather than have a single emergency declaration that is then extended or is revised for a new amendment for a new effective date, they let the original emergency declaration end and then declare a new declaration. So we like to recognize what is the initial declaration because there is that difference and because there is set periods of time that a single declaration is in effect before a new one is in effect. The last thing before we get into our scope criteria is miscellaneous notes. Our scope criteria is not all encompassing. There are things such as polling standards, vaccine standards, anything to do with the election. There were orders pertaining to those that we included, but we do not have specific scope criteria for them, meaning that we have our interns physically type out a note about what this order pertains to and what the order applies to. This allows for any researcher or viewer to search for that term and identify the orders that they are looking for without us having to change our scope criteria or edit it drastically. A little bit of fun we've had is our note section also allows us to recognize the goofy orders we find. Some states have said the Easter Bunny and Santa Claus are exempt from the stay-at-home order or they're exempt from social distancing and that they've already received their vaccine. There have actually been multiple states that released, signed, and published the orders pertaining to that. So we have called those out in our notes section because they offer a bit of levity and a bit of fun showing the humor of the government in that state. The bulk of our spreadsheet and of our data set is this scope criteria. The scope criteria content was drafted and created in collaboration with the Temple University Center for Public Health Law Research. And in our data set, it is all represented by binary variables, being that if a 0 is in the spreadsheet, it means this content is not included in the order. And if there is a 1, it means it is included in the order. So you all likely are very familiar with these terms by now, but the terms apply to if there's a stay-at-home order, if there was a length of a curfew, a mask or facial covering requirement, a gathering ban or gathering suggestion ban, social distancing in terms of feet, in terms of indoor-outdoor activities. The operations of businesses, restaurants, and schools pertains to closing, reopening, curbside carryout. It could be virtual school, asynchronous school. All levels of school are also included. So K-12, private, public, and collegiate, trade schools, all of those that are included in orders are included in our data set. The travel restrictions specifically pertains to if people are entering or exiting that state or county, if there are restrictions on what they must do, whether they must quarantine or stay out of the state specifically, anything pertaining to travel. Correctional facilities pertains to any type of correctional facility, a prison, jail, juvenile detention center, any type of holding facility, psychiatric facilities. These type of facilities were ordered in some states to hold people longer, depending on if they had a release date, or release people sooner, just depending on the capacity and how they're able to handle things. So we do recognize and include those in our content. This is an overview. These are links, so when this information is shared, these will be accessible, but this is how we publish our data set. On the actual program's website, we publish a link to the shared Google folders, the publicly shared Google folders, which will look exactly like that previous slide with the breakdown of the folders. And then the shared Google sheet that I'm about to show you is also shared with everything you will see in the exact format you will see. However, we know that Google is not the preferred format of some researchers, and it's not always user-friendly if you are unfamiliar. So we do also have a BroadStreet GitHub repository. On this repository, we have the COVID-19 data project's datasets, including the health equity dataset and the daily numbers dataset that I mentioned prior, in addition to a new special project we have released called the state grades special project, which looks at how states are doing compared to what is expected of them per research. For the policy repository on GitHub, we have a zip file of all of those text files you've seen, including the folder breakdown, and the spreadsheet dataset, which is available via a CSV file. Now I will show you exactly what that CSV file or the Google Sheet looks like. So this is an example of the Google Sheet version. As you can see, it's very pared down compared to that image you saw before, and it has a lot of content on it. This is everything that we walked through prior, including the identification, content, and the binary variables. In order to fully understand all of these numbers and hopefully clarify some of what may look like gibberish, I'm going to walk through this particular order that is highlighted in blue, just as an example. So starting from the very far left is how you would read our data set, is the identification number. This identification number is the FIPS code, and the FIPS code also corresponds to the other data sets. Yes, there are FIPS codes for the states. We also have FIPS codes for the counties and the territories. We pull these directly from a US Census website that is shared between the tracks, so that if you were to ever look at all of the tracks data sets, you would be able to compare them directly. The geotype, as I mentioned before, allows us to keep everything on the same spreadsheet and in alphabetical order. So for Alabama, which this order pertains to, it is a state, and this order pertains to the entire state. Like I just said, this order is for Alabama simply because it is in alphabetical order, and this order has some interesting details in it. I can see that the order name is SHO6, which I have learned means stay-at-home order 6. You might have seen this pop up, or you might notice the black triangles on the cells. These are how our interns cite the order itself. If you are looking at the data set on Google, you will see each of these individual notes on the cells themselves, and you can read them as citations. However, if you are looking at the data set as a CSV file, you will not see the individual notes on each cell, and it will likely download as a separate sheet. We have not found a workaround for this, but that is why we offer both, and so that you can pull it up on the internet and look at the individual notes. That being said, for this stay-at-home order 6, I'm offered more information in the note that says, it is the order of state health officers suspending certain public health gatherings due to the risk of infection by COVID-19. That's far too much information to put in the cell, and that is why we use the note. The next column is about amendment, and because it is a binary cell, a binary variable, I know right away just by seeing the 1 that this order, stay-at-home order 6, is an amendment to a previous order. By looking at that note on the cell, I can see that stay-at-home order 6 amends the stay-at-home orders dated 3/16, 3/17, and 3/19. Using that information, I could go find those stay-at-home orders with those dates to find out exactly what is being amended. The next two columns pertain to the dates. So I know just by looking at this that Stay-at-Home Order 6 has a starting effective date of April 28th and an ending effective date of May 15th. You may often see zeros, which represent no, as an end date. That just means that the order did not include a specific end date, and it likely said this order is in effect until it is rescinded. Due to the uncertainty of the pandemic and the rapid nature in which these orders were released, that is a very common finding that not all orders have end dates. If they do have them, we did do our best to include them. Column H, initial emergency, pertains to if the order is the initial emergency. This column allows us to call out states like Michigan that have those varying initial emergencies or varying multiple emergency declarations. The next column, continued emergency, is how we recognize if something pertains to COVID. Although this was not the initial emergency, Stay-at-Home Order 6 is in relation to COVID because this has a 1 in the cell. I know that right away. Reopening tells me if the order is related to reopening measures, and I know that it is not because of this 0. Stay at home pertains to if there are stay-at-home measures included, if there is recommendations or requirements, and I know that there are not any requirements in this particular order. Although it is called Stay-at-Home Order 6, I know from reading the title previously that it has more to do with a gathering ban than an actual stay-at-home order. And that is also clear in this coding. The curfew tells me that there was no curfew specific to this order that is implemented for the state of Alabama. I do see that there is a mask requirement pertaining to this order. I can tell by looking at the note that the mask requirement says wearing face coverings around people from other households when it is necessary to leave the home. Due to the nature of how this note is formatted, I can also tell you that it was copy and pasted directly from the order. So this is citing Stay-at-Home Order 6 directly. And this was something that was included in the order. For gathering ban, there's also a note telling me that yes, a gathering ban is included in the order. And the specifics are that all nursing home and healthcare visitations are prohibited. As of April 30th, 2020 at 5 p.m., beaches will be open to a gathering of no more than 10 people. Work gathering can't exceed 10 people, while non-work gathering can't exceed 10 people unless social distancing is maintained. That is also directly copy and pasted from Stay-at-Home Order 6 as the intern was reviewing the document. If you've ever read the orders pertaining to COVID or even any actual orders in their entirety, you know there's a lot of extra information. There's a lot of background information and very specific legal language that is included. Our interns do their best to avoid that and translate it into only the information that is pressing so that anyone can understand just by looking at our data set. Social distancing, I also can see that 6 feet apart is required. That is pretty standard per the CDC, so that is more often than not what is seen in every single order. The next 3 columns, businesses, restaurants, and schools, pertain to those operations. So Stay-at-Home Order 6 for Alabama tells me that all entertainment, athletic, and close contact facilities and businesses are closed as of March 28th. Retail stores are limited to no more than 50 people as of April 30th. As you read through our data set, these notes become even more important because this is also where we specify as businesses are reopening, especially retail stores are reopening, those variances and those differences are included and highlighted. For restaurant, I can see that all restaurants and bars are not allowed to provide on-premises services and are encouraged to utilize curbside or online services. This is another area that Stay-at-Home Order 6 is very specific, and orders in the future would get even more specific as curbside is relaxed or not as strongly encouraged. For schools, I can see that as of March 20th, 2020, all educational facilities are prohibited from conducting in-person or classes. This again is a very particular variable because there is such variance with schools, whether it be asynchronous or in-person or virtual. There are a lot of regulations from the government coming to the schools that we have recognized and we have included in our data set. The next column recognizes medical procedures. Specifically, we are looking at elective procedures. We also highlight abortion services. Early in the pandemic, it was seen that abortion services were debated whether they were considered elective or emergent. And so they are often highlighted independent of any terminology in the orders. So medical procedures for our scope includes elective procedures and abortion services. Stay-at-Home Order 6 says that all healthcare facilities starting April 30th at 5 p.m. may continue operation and medical procedures unless the state health officer or his designee determines that performing them would, basically it would be bad. This is an example. There's a lot of information and we just cite it because it's a little hard to translate unless you are in that field and you know exactly what it is pertaining to. The last two columns here are travel and correctional facilities. I can see that for travel, that minimizing travel, especially if you are sick, is encouraged. As the pandemic progressed, it became a lot more specific in the orders, but this order in particular is not as specific pertaining to states or pertaining to length of quarantining. It just recommends minimizing travel. And the last cell is correctional facilities. This order in particular does not pertain anything to correctional facilities. And now I know the entire scope of this Stay-at-Home Order 6. Simply by reading yes or no if the content was included, and then reading the notes to understand more. If you have any questions, please feel free to use the chat box. After I stop sharing my screen, I will also be able to see the question and answer section. I do have some pre-prepared FAQs that I can go through. It might spark your memory or your mind to come up with other questions. While you are typing those, I will go ahead and go through them. So I've often been asked if school operations in our scope content includes a review of private universities' policies. It does not. We solely look at orders that are published by the government, whether it is on behalf of a public health officer, the mayor, or the governor themselves. We do not look at individual schools pertaining to if they are requiring on-campus or off-campus living, housing, anything like that, because of the complexity and the sheer number and size of what those policies would pertain to. Have we seen differences based on political representation? So this is an interesting question because we have seen differences, but we are very aware of the location and the tenure of some of those representatives, excuse me. The main difference we see pertaining to political representation is in states where the mayors have more power pertaining to their particular location. For example, in Texas, there have only been around 32 state orders that the governor has signed, but there are hundreds for each individual city that the mayors have signed. This was one of the reasons that we felt it very important to get city and county level orders into our data set to find these details and the specific qualities of the orders. Have you seen geographical differences? These differences do come up more often than political representation in terms of states that are more populous or even cities that are more populous. The states specifically in the West or in the Central West have less populous city metropolitan areas do have fewer orders than cities such as New York City that are very populous and very dense with the sheer number of people that could be infected or could spread coronavirus. Have you seen a correlation with case counts? This is a question that we are asked a lot because of our other data sets that we are keeping count of cases and deaths. We specifically as a project have not compared our data sets to draw a direct correlation between the number of orders or the quality of orders compared to cases, but it is something that multiple people have stepped forward and showed interest in pursuing. And it is something that could be done with our data sets. What was the effect of the holidays on order release? So we have had multiple holidays from March until now, and we have also felt the effect of the holidays, both in terms of the volunteers able to work and the number of orders being released. The average number of orders that are released each week is around 30. This is for the states. The cities are released at a much different pace, but the states and territories are often released around 30 per week. During the holidays, this drastically dropped for obvious reasons. Those writing the orders, those releasing the orders, those publishing the orders were taking their own vacations and spending time with their own family. And there were also more all-encompassing orders released prior to the holidays so that they could enjoy some time off. During the holidays, the number of orders released dropped to around 10 to 15. What was the effect of the election and/or inauguration on order release? Similar to holidays, this did impact the number of orders released. It actually spiked prior to the election because of polling regulations and restrictions on where you could line up for polling with social distancing, how they would be staffed. But while the votes were first being counted, and then again with inauguration, when it was actually occurring, there were very little orders released because everyone was focusing on what was happening in Washington and for the election. And everyone was looking away from what COVID was happening on their doorstep. They were able to do this because there were blanket orders released to cover this time period so that they could focus on other things and look at other things. In the states that saw a change of power with senators, and even those who were getting new representation or having a runoff election, they did also have much less orders released because they're focusing on those efforts. I am not able to open the question and answer while sharing my screen, so I'm going to stop sharing. I can reopen it. I see Elizabeth McNeil has asked, have you seen any information on vaccination as the vaccine rollout has begun? Yes, we have. There have been many orders released pertaining to how the vaccine should be released and who should access the vaccine first in terms of the rollout policies in how it, I live in Ohio, so Ohio in particular has released orders pertaining to how the medical professionals are going to receive it, what schools or teachers are going to receive it next, and the order in which those are going to be released. This is not all encompassing. There have been many states that do not release orders pertaining to the vaccination and instead release press releases. My assumption is that they do this so that the news has less fallback or regulation on them. So if they fail in their rollout, it was only a press release and not an order that they then have to amend or rescind or continue changing as things are affected. I am not seeing any other questions at the moment. I am happy to answer them from the chat box or the Q&A panel. I'm also happy to reshare. So I'm now getting a question about what are the next steps pertaining to getting started with the internship? This is a great question. Each month we have a new cohort of interns that start, which means we are consistently accepting new interns and allowing new people to get started. In order to do that, there is a very simple application link. I will include it in the follow-up email after this webinar has ended, and you can also find it on our website. It is a short application because we do welcome all to join, and you are very self-sorted if you do not have the time to complete the needs of the internship. I can also let you know, if you are interested, that we have been able to offer course credit through our internship for many students, both in undergraduate internship requirements, volunteer requirements, and practicums for MPH students. While I'm waiting for any other questions to come in, I will also tell you that this recording will be posted in a follow-up email after the webinar has ended. And we are also working to get it added to our YouTube page. So if you ever would like to access it again or submit it and send it to any students you might have, if you're a professor, or any friends or family, you are able to do it and forward it to others. If you have submitted an application to our internship, you do know that the internship is scheduled to be 10 weeks long. We have this designation simply because that is close to the length of a semester for students, but you are able and welcome to stay well beyond the 10 weeks. After the 10 weeks, we have more opportunities that open up, including leadership opportunities and opportunities for further skill development in various regions that the project touches. Andrew is asking if the dataset is all-inclusive in containing all county data throughout the United States. For the policy dataset, it is not yet all-inclusive. I mean that to say, we have not been able to identify orders for every city or county in the United States, but every month we are looking to expand our list and get more data for the counties that have offered orders. The daily numbers dataset does in fact include every county in the United States and Puerto Rico. I believe that number is around 3,000 counties, and that is why we have the sheer number of volunteers that we do, so that no single person is entering too much data. Our health equity data is not all inclusive because not all counties release the same amount of data. Specifically for race and ethnicity, there are differences in the races that are represented in the data and the ethnicities that are included. We do, again, expand the list of counties that are included every month in hopes of finding new counties that have a wider range of information or are in fact releasing that information for the first time. So each month when we release our published data, it does grow and it does expand. Are there any efforts to collect data from other countries' response to COVID, or the data is only from the US? So our project in particular, it's interesting you asked this. We have interns from across the world. We do everything virtually. So we have meetings virtually with people in about 15 different time zones, and they are able to speak on what is happening in their countries, but we are only reporting data for the US. We do this because it is what we are all most familiar with and what we are all most able to understand due to the complexity of not only the US system for reporting, but other countries and how they do it even differently. When do volunteers typically work? This varies depending on what track someone is in. For policy, like I said, there are the meetings that people work together. Those occur on Thursdays, Saturdays, Sundays, and Mondays, and are only for about 90 minutes at a time. During that 90 minutes, the teams are able to collect data on about 30 to 35 orders each time. So each week we are completing data to be reviewed and not corrected, but reviewed and prioritized about 100 to 150 a week, depending on the length and depth of each order. The other tracks all work in teams, but they work independently. Many of the state websites that are used, or even the county websites that are used, are overwritten each night at a certain time or once a week at a certain time. These are very defining parameters that we have had to recognize and understand as we build this project. And so each team has a set schedule for when they work. We do have representation from the volunteers 7 days a week, but it is not 24 hours a day. It is based on just collecting the data and then when the people are available. The majority of our interns are students, so we are welcome to that, and we do respect that, and we do prioritize their schoolwork and their needs for studying or completing assignments. And we ask them to communicate their availability and complete work around their other needs and priorities. Just to expand a little further on how our cities are included in our data set for policy. We look once a month and we pull from just an alphabetical list of cities that are the top cities in the US based on population. This is just the best way we found to get a variety of cities from across the United States. And we have also looked at each state's capital to try and find at least one city and or county for each state. However, we have not been able to identify orders for every city that we look at. And so we again have to recheck those same cities every month. Our current list that the interns are currently working on as of yesterday is around 150 cities. These cities represent multiple counties and take some overlap between what's considered a county and what's considered a city in terms of what the order applies to. We do designate that, but it is something that makes a difference as we go through our QA process. If you have submitted an application for the internship and you have registered for orientation, you do not need to upload a CV or cover letter. We are welcoming of all, regardless of your level of experience, because the most important thing is that you are interested in helping and interested in making the difference. If you upload your CV or cover letter, we will read it. It may help get you sorted into a track, but it is by no means necessary. The most important thing is if you are interested, excited, and if you're available in terms of your weekly, hourly amount and available to learn the processes that are currently in place. If anyone else is typing questions, I will just continue to offer some more information about our internship while you do so. Our internship is all based online, like I said. The interns all have access to the data sets that are created, both for research purposes, personal school purposes, if they want to share it with friends, share it with family. It is all publicly accessible. Our data sets are all published, like I said, on GitHub, which is a platform we are all beginning to learn together, and something that we are all working towards in terms of building it out and making it more diverse. We recently began working with some students that have coding experience to standardize and automate some of the processes for gathering our data, and this will allow us to speed up our creation and generation in order to diversify and expand our content. The question pertaining to, do we get to choose the time zone for working in team meetings? I assume you're talking about the team meetings for policy. Yes, we do try and adjust everything to everyone's time zones. We offer each meeting to every intern that comes in so that we are able to best meet their needs in terms of their schedule, their time zone, anything. If an intern is unable to make a meeting because of the time zone, we do not restrict you. We do not say you cannot participate. It does mean that more is left on the interns to watch recordings of videos or watch recordings of the meetings or even work independently. But we do work with the intern to meet their needs as best as possible if they are motivated to maintain their role on the project. I can also tell you that one of our new leaders of the February cohort that is up and running and training this week is actually in the United Arab Emirates. So our team meetings that take place around 3 p.m. Eastern are actually at midnight over there. She is very happy and she considers herself a night owl. So it works out well for all of us that she's able to take on a leadership role and also teach others about where she is in the world. I'm happy to continue answering questions if any of you have them. If you would like to ask via email, feel free to reply to the follow-up email that comes after this webinar, and we can continue discussion that way or set up a call separately. I do thank you all for coming. This is a very large and very inclusive project that I'm happy to be a part of. And as it continues to grow, our biggest wish is for others to see it and others to be impacted by it. So just by you coming and attending or you watching this video of the recording, you are making our wishes come true and learning more about it. And hopefully we are able to help you by offering you this data set. I do not see any other questions. So I have two more questions that came in. Can you please provide the website or email ID for submitting application? Yes, it will be included in the follow-up email. I will place it there. I can tell you it will also be on the website if you review the project's website, which is the COVID-19 dataproject.com. Will original policy web pages be archived as well? So we do take everything offline. We do not use web pages in our data sets. We try as much as possible to get the content of the actual order. This does mean scraping HTML into a plain text format and also converting PDFs so that the PDFs are in a machine readable format that anyone is able to access and manipulate into coding or standardized format. In terms of the web pages where we get the policies, they are included in our sources and are cited in a document on the GitHub if you would like to access those. We're almost to the top of the hour. I thank you those who have stayed on this whole time. I am going to hang out just a little bit longer. If you have a class or a meeting to get to, feel free to hop off and go about your day. Again, I thank you for coming and listening to me share about our policy data set for the past hour.